Hello and welcome to Dr. Varman's Vision Academy. In this video, we are going to tell you how to achieve the perfect small incision lenticule extraction procedure repeatably. So this requires you to perfect 5 steps. You need to have the perfect drying, the perfect centration, the perfect dock, adequate energy settings and a perfect dissection technique. So this step, the drying, is a very important step. You need to ensure that the conjunctiva is absolutely dry, so you do not have suction loss during the laser application, and you need to have the cornea at least moderately moist to ensure that the laser pattern you achieve is very good and does not have any black spots. So this is a soft dock approach in which we ask the patient to fixate at the green light, so we dock at the corneal vertex. As you get closer to the cornea, slow down your approach, and when the cone is 70% applanated, you can activate suction. Do check the pupillary centration. If the pupil is very badly decentered, you might be having a decentered treatment. If you are on the VISUMAX 800, this comes along with the Centra aligned software, which gives you a guide as to where the corneal vertex is, so you can have a perfect treatment centration very easily. So we have to address the ideal energy settings. The ideal energy setting will not have any feathering, no opaque bubble layer, it will not have any black spots. You will find an even pattern everywhere, which allows you to have a smooth dissection. So this energy setting can vary from machine to machine. It is for you to see which ideal energy setting works the best. So we are now just starting with the dissection technique. The first step is to open up your incision by using the tip of the dissector and lifting up on the edge of the cap to achieve the auto decompression of those femtosecond bubbles. So as you open up the incision, point the tip of the dissector upwards so we enter the superior pocket, which is the cap interface between the lenticule and the cap. Following which, we make another entry into the inferior pocket, and this entry is made purposefully small just to ensure that we don't inadvertently enter the posterior plane when we start our dissection. So this is the superior entry. And now we are just opening up the edge of the lenticule, and we make that opening under the lenticule a width of 0.5 millimeters only, just to delineate the two planes. Once again, this is the superior plane and this is the inferior plane. So now we start with the dissection. So when you are dissecting the superior interface, do dissect it with a bit of a superior bias, and when you are at the inferior interface, you have to perform an inferior bias while dissecting. So when we are at the cap interface now, you have to lift up on the cap gently to ensure you are in the cap interface. So when you are doing the cap dissection, dissect from edge to edge, encompassing the whole circumference of the cap, leaving no undissected areas. And when we start the inferior dissection under the lenticule, do have a slight inferior bias to ensure you are in the posterior plane. The difference in the inferior dissection is that we must only do the central dissection first, while keeping the edges of the lenticule intact to act as an anchor before separating out the edges. So in this technique of edge sparing dissection, we leave small anchors of tissue undissected just to act as a support while finishing up the edge dissection, so we have an intact lenticule which is not folded over before we complete the whole dissection. So as we see here, now we move out of the edge of the lenticule and we dissect about 6 clock hours to the right. We leave a central uncut edge intact to serve as an anchor to support the lenticule to avoid it folding over as we finish the rest of the edge dissection. So as the edge dissection is complete, we can finally dissect that anchor of tissue to ensure that we now have a completely free floating lenticule which can be easily removed with the help of a forceps. For the final removal of the lenticule, we can use the same instrument and just express it out, or you can use a forceps to retrieve the lenticule from the lamellar pocket. So if your dissection is good, you will have no struggle in removing the lenticule completely. So let us now review this in real time. So starting it by opening up the incision, lifting up on the cap edge and entering into the superior plane, which is the cap interface. We make this entry as wide as possible, and now we just open up the edge under the lenticule and make it a small entry just to delineate our planes. We now lift up on the edge of the cap, have a superior bias and dissect the cap interface edge to edge, ensuring that no part of this interface is left undissected. Adopt a windshield wiper kind of motion, pivot in the incision to ensure that you don't have any extension of the incision because of your movement of the instrument. And now we can enter under the edge of the lenticule, which is the posterior interface. Make that entry a little wider so it might be easier for you to enter with the dissector. So as we have mentioned in this video, this dissection is meant to be kept only central. We don't dissect right up to the edge of the cap here, only dissect the center of the lenticule. And now we are ready to do the edge dissection. Edge dissection is done in a way that there are anchors of tissue which are left behind to act as a support. And finally we remove those anchors at the end and we have a free floating lenticule which can be safely retrieved with forceps with no difficulty whatsoever. So to summarize, the 5 steps to perform a perfect smile are perfect drying, perfect centration, achieving a soft talk, optimizing your energy settings, and adopting a repeatable technique of lenticule dissection that works every single time. Thank you for your attention and do subscribe to our channel.